Good morning, everybody. How was your morning so far? Good. Did you guys get to have a coffee? Good, good, good. Did any of you ever woken up in the morning with headaches or migraine? How about jaw pain? Have you ever woken up after 8 hours of sleep and yet feel sluggish? Well, all these problems can be connected to what we call TMJ, or temporomandibular joint disorders. Now, T, it stands for the temporal bone, the bone in the side of our skull. M is the lower jaw, the mandible. And these two bones are connected with a disc called temporomandibular joint. Now, we need to pay attention to this. The upper and the lower jaw need to be working together in this perfect region. Otherwise, if due to trauma or incidents or accident, our bite is off, we're creating temporomandibular joint disorder. Now, if you look at this slide, you can see the main artery passes right behind the lower jaw. You can imagine if the bite is off, you're cutting the circulation to the brain. Now, the next slide is going to show the complexity of that region. Look at the nerves, arteries, and veins that pass in that region behind the lower jaw, and you can understand if the bite is off and the jaw is pushed back, again, due to trauma, injury, and many other reasons, we can cut the circulation to the brain and impinge the nerve that passes in that region and create stress. And that stress turns on what we call sympathetic nervous system, which is fight and flight. Now, what is sympathetic nervous system? It's shown here in red. It's usually referred as fight and flight, is our body's mechanism to survival. Now, imagine a lion is coming at us and we're running for our lives. Do you think we can sit down and enjoy a cup of tea? Of course not. At that moment, your whole body is in survival mechanism. You're running for your life. Your whole sympathetic nervous system is in full swing. Your heart is beating fast. Your mouth is drying up. Your eyes is dilated. You start clenching. Now, human beings can be in this state short amount of time. Research by Harvard University has shown that if we are in this chronic state of sympathetic nervous system activation, day in, day out, clenching, grinding, we're actually taking a toll in our physiologic and mental health. And in long run, it can contribute to high blood pressure, clogged arteries, and even brain changes, which can lead to depression, anxiety, and even addiction. Now, adults are not only affected by this, children are also affected by this. Untreated TMJ can have patients with untreated TMJ can have symptoms of headaches and migraine, jaw pain, clenching, even vertigo, tinnitus or ringing in your ear, and some neurologic disorders such as Tourette's can be associated to TMJ. Now, how is a neurologic disorder such as Tourette's is related to TMJ, a structural problem? A research led by Dr. Shannon Bennett et al. From Weill Cornell Medical College has shown that if we get children with movement disorder and place a bite plane or an orthotic in their mouth and move their lower jaw forward and open their bite, we're actually reducing their tic severity. That's mind-blowing. Now, according to the paper that was just published this April by Dr. Bennett, there's two hypotheses. One, that when we move the lower jaw forward, we're actually taking the irritation from a nerve that passes in that region called trigeminal nerve. That is our biggest sensory nerve in our body. That's maybe why the tics are reduced. Her second hypothesis is by moving the lower jaw forward and opening the bite, we're actually opening the airway. And by doing that, we're reducing the sympathetic nervous system activation and improving the heart rate variability, and that may be her reason of why the tics are reduced. But one thing we know for sure, that there's a connection between the tics and TMJ. And this opens up door for more research opportunities and collaboration between dentists who treat TMJ and neurologists. And in order for us to better serve our patients, we need to create a bridge and work together. Now, again, children are affected by TMJ as well. Talking about sympathetic nervous system activation, let's take sleep, for instance. When we sleep in our back, our lower jaw falls back. Our tongue's attached to our lower jaw falls back with it, and it closes our airway. That's when we gasp for air and stop breathing. Now, if we stop breathing for 10 seconds or more, 5 times more per hour of our sleep, it's considered sleep apnea. Now, the image on the left is a patient diagnosed with sleep apnea on standing up position. Take a look at the image. The airways completely collapsed on this patient standing up when we're taking these images. Can you imagine the sympathetic activation that happens when that patient sleeps on their back? That's when they start gasping for air, and they're agitated, and they wake up several times to go to bathroom. And I can't imagine the toll it takes on the body. Now, untreated sleep patients can have comorbidities, ailments that are associated with sleep, such as heart disease, erectile dysfunction, GERD, ADHD, hyperactivity, and even diabetes type 2 is related to sleep. Now, we can't leave this silent killer untreated. Treatments of sleep apnea are CPAP machines prescribed by medical doctors in the field of sleep, or an oral appliance that's FDA approved by a dentist in the field of sleep can be made, and there are surgical treatments that are available for patients. But we can't leave it untreated, and I personally know people in my lives in Manhattan Beach that lost their life to this silent killer. Now, children are also affected by sleep, and they show their symptoms by bedwetting, behavioral issues, learning disabilities. And I've often seen in my practice kids that are accompanied by their parents, and they're hyperactive, and parents are embarrassed by their hyperactivity and asking them to sit down. But what they don't understand is that kid is moving for survival mechanism. If they don't move, they can't pump oxygen in their blood. I ask the child to do a simple exercise and hand them a tongue blade and have them to bite on it lightly. By biting on this tongue blade, they're moving their jaw forward, opening the airway, and improving their heart rate. And I ask them to deep breathe, and within seconds, they're calm in the chair. And that's when I know that we need to address their sleep problem in their treatment plan and work with physicians on that aspect. Now, talking about sympathetic activation reduction and all of that too much, now let's spend some time on parasympathetic nervous system. Well, parasympathetic nervous system is actually where you want to be most of your life. That's actually the time that you can sit down and enjoy your cup of tea, where you want to rejuvenate, reconstruct your body's cells. And that's where we want to increase that state. And one simple exercise is just to do breathing exercises. Everybody's hearing about that now. Now, when we do these breathing exercises, we want to intentionally slow our breaths, take the deep breath in, hold it, and relax and let the carbon dioxide come out. And by doing that, you're not only increasing your parasympathetic activation, but also you are improving your heart rate and enlarging your capacity for your lung. Another exercise that I want to teach you today is if you're behind your desk in the office and you're stressed or you have a migraine or headache, just do this for me. Grab a pen or a pencil, wipe it, make sure it's clean, there's no COVID on it, and then bite on it lightly. Notice by biting on it, I prop my lower jaw forward and opened up the circulation to my brain and opened up the airway. Bite on it lightly now. You don't want to bite hard. But take a few deep breaths while you're biting on it. And within minutes, you will find that your headaches is gone and you're able to have more clear thoughts. Now, I know you all will remember this slide in the rest of your life. But what I want you to remember is this, and what passes behind the lower jaw, and the importance that lower jaw placement plays in our health and well-being, whether it's physical or mental. And now I want you all to join me in relaxing your jaw, taking a deep breath, and allow the parasympathetic nervous system to wash over your body. Thank you.